Addiction being a choice is a narrative that too many people believe without taking a closer look. Those who talk about addiction being a choice rarely have the credentials to back up their opinion on the matter, nor do they have an understanding of how addiction affects the brain. They also don't realize that by holding that view, they continue to perpetuate the awful stigma associated with addiction. When addiction starts out, a person may make the choice to use a substance recreationally for the experience. They might be curious of what it's like. While this is a bad choice, it is important to think about the fact that we have all made bad choices in our lives. Some of us have been lucky enough that our bad choices did not disrupt our lives in any majorly significant way. We can't look down on a person for being curious and think that since they chose to use in the beginning, they're just a terrible person and that's that. It's also worth noting that sometimes the choice to experiment with drugs and alcohol happens at a really young age. For example, a 13-year-old is way too young to fully understand what they're getting themselves into by experimenting with drugs. Or consider the person who grew up in a household that is full of drugs and alcohol. That person, compared to others, wouldn't really have much of a choice because they grew up in that environment. Not to say that everyone who does becomes addicted, but there's a higher likelihood that it will happen if it's in the environment that they grew up in. It is also important to consider all of the factors that lead to making the choice to use drugs and alcohol. Some begin to want the experience of drugs because they see it as an escape from traumatic memories or circumstances in their lives. For example, 75% of women who enter into substance abuse treatment report of having a history of sexual abuse, and that's a very large percentage. There's a relationship between trauma, mental illness, and addiction. They feed into each other. It is important to never write someone off as being a bad person without first getting a true understanding of the experiences that shaped them. You should ask yourself questions like, what led them down this road? No matter what the answer is, it's clear from a scientific perspective that once a person is using drugs on a regular basis, or sometimes even after the first use, major changes in the brain function take place. Sometimes it's like a light switch that gets hit and all of a sudden they find themselves completely unable to put the substance down. Because addiction is a progressive disease, choice completely disappears over time. Sometimes people do not realize that their choice to stop is gone until it's too late. Meanwhile, the more they use, the more their brain changes. Addiction overrides the basic needs such as hunger, thirst, or the need for shelter. Where in a normal person these basic needs come first, a person who is addicted to drugs or alcohol will only think about drinking or using. Specifically, addiction changes the brain in areas that have to do with memory, motivation, and reward. Eventually, the addict starts to choose the substance over literally anything in their lives. It's more like something that initially is a choice and then turns into a disease. There are other illnesses that happen because of an initial choice, but most other diseases are treated with compassion and empathy by society. It's no surprise because addiction tends to have consequences not only for the person addicted, but for everyone around that person. This is another reason why addiction is looked upon so harshly, because the actions of an addicted person are difficult to understand or deal with. But addiction at its core is a result of many factors, both environmental and biological. It cannot be summed up in simple terms, although it is tempting to dismiss it in this way. Drug and alcohol treatment is designed to address the ways in which addiction changes the brain. This can be accomplished through many different treatment options, such as cognitive behavior therapy, one-on-one therapy, group therapy, and family therapy. The best treatment centers are those that use treatments that are proven through evidence to work in helping undo some of the damage done by addiction. If you or someone you know is addicted to alcohol or drugs, don't waste any more time. Call today and speak with one of our addiction specialists. We'll learn about you and your situation and find out your options for drug and alcohol treatment.